Hello ladies, Dr. Nikki here. Thanks again for tuning in. It is an honor and a privilege to share this time with you. It really is. Today I wanted to share something that is really important to me, and that is the concept of childbirth and specifically postpartum care, specifically, even more specifically, the first few weeks after giving birth. As a physical therapist that has specialized in women's health and pelvic floor physical therapy for the last decade, I have had the opportunity to work with thousands of amazing women during pregnancy and after giving birth, and even years after giving birth. And one thing has proven true time and time again, and that is this. Delivering a baby is like spraining your vagina. Truth. It is. If you were to really look at the definition of a sprain or a strain, it's a trauma to the soft tissues of the body. Well, your vagina is part of the soft tissues of your body, if you didn't know. And going from, a couple of inches, not even, maybe an inch or two of diameter, to 10 centimeters, accommodating a child or a baby's head and shoulders as that little tyke is going through that canal, it's like a strain. And it's not like the baby just slips on out if you've given birth. I have not given birth, full disclaimer, but I have witnessed 2 amazing natural births. Thank you, Ashley. And it's a strain. It's a sprain to your vagina. Sprain, strain, it doesn't really matter. What my point is that it's not treated that way. It is not treated like an injury. And I'm not trying to make childbirth look negative or bad in any way, because it isn't. It's this beautiful, amazing miracle of life. And it's a gift as a woman to have the opportunity to do that. However, it is an injury. It is a trauma. Call it elective, but nonetheless, these tissues need time to heal. These tissues were just traumatized, basically, or injured. So my advice to you and every other woman who will ever give birth, who will ever watch this video, is to treat yourself like you were just injured, whether the medical community is treating you that way or not. Unfortunately, in this day and age, especially in America, healthcare has become a business. And I'm not going to get into the politics about any of it now. But what I am here to tell you is that you deserve to be treated with the utmost honor and respect after having a child. I don't care if it was through the vagina and you sprained your vagina, or if it was through a cesarean section and you basically had an abdominal surgery. Either way, it's a trauma. You injured yourself. And postpartum care needs to adapt to accommodating a woman like it was an injury or a trauma. So what would you do if one of your dear friends just had abdominal surgery? Would you send them home after the hospital and then be like, yeah, just do whatever you feel like you can do? Or would you mother them and baby them and nurture them a little bit and make them food and tell them not to get up and do the dishes? Of course you would. Of course you would. One of my biggest soapboxes, which I will probably say time and time again, is giving birth is like spraining your ankle, except that in America, you get way more TLC if you actually sprained your ankle than if you gave birth to a human. Think about it. You're playing soccer, you roll your ankle, you go to the doctor, they give you an x-ray, they give you some painkillers, they give you crutches for free most of the time, and then they send you home. They might even give you a week off of work for spraining your ankle. What happens when you have a baby? You have a baby, you spend a day pushing this thing out, not to mention the 10 months of bodily changes that had to go on before you even gave birth. And then you're in the hospital for a day or 2 if it was a vaginal birth, or maybe 4 days if it was a cesarean section. And the doctors are like, okay, cool, bye. Call me if you need me. Call me if you're dying. No. So, I don't know whether this one video is gonna make the big difference that I want to see, but I will keep saying it. But my point, without rambling too long, is that I want you, after giving birth, to be treated like you just had an injury to your vagina, because you did, or your abdomen if you had a cesarean, because you did. So you now have my permission from Dr. Nikki to rest and be treated and mothered like you were just sprained your whole body. So anyways, I have more information about that. If you want to read about it, links are below. 2 free downloads for you to peruse at your will. So obviously you can always reach out if you have any questions too. I am honored to be a part of your pregnancy and postpartum journey. Until next time, bye.